Have you lost a loved one or family member to early death from heart attack or stroke? Is there a strong family history of cardiovascular disease in your family? Is one of your greatest fears dying an early death due to a cardiovascular event such as a heart attack or stroke? Well, there is testing available that is cash-based that you could have done today to determine your 5 and 10-year risk of a cardiovascular event. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Cardiovascular disease is the #1 killer worldwide and the #1 killer in the United States. And oftentimes, the lives it claims are lost abruptly and without sign of its coming. We all probably know of someone or know someone who seemed perfectly healthy one day, and then we woke up the next day and heard that they had passed away from a heart attack or a stroke abruptly. And this is happening every day in the United States. Why is this happening if we have risk markers such as lipid panels and inflammatory markers and body weight and such and things like that? Well, the reason it's happening is because those have each been determined to be independent risk factors for cardiovascular disease, but they are not the best indicators. The best indicator is knowing the amount of coronary artery calcium, or how much calcium is making up the arteries of your heart, because the calcium is an indicator of plaque buildup in the coronary arteries. And the best test to determine that is called a calcium scoring CT. So you get a CT scan of your heart, and it measures the amount of calcium in the arteries of your heart and gives you a score. Well, that score in the research has been shown to be the most accurate, superior to all of those other cardiovascular risk factors that I stated earlier. And studies have shown that you may have high inflammatory markers, high lipid values, including high cholesterol, high BMI, and because having those high markers just by themselves, you could be told by your doctor that you're at a high risk of heart disease or stroke. But research has shown that people with high markers here, but a 0 score on your coronary calcium scoring, are at actually a very low risk of cardiovascular event, versus the patient who has who has seemingly perfect inflammatory markers, perfect lipid panel, perfect BMI. That person would be told by their doctor they are not at high risk for a cardiovascular event. But if they have those no risk factors, but a high coronary artery calcium score, they are at a very high risk for an event in the next 10 years. And compared to the person with high lab values but low coronary artery score, the person with the high coronary artery score but low lab values is at greater risk. So the calcium scoring CT is the test to do to know what your 5 and 10-year cardiovascular event risk is. But even more important than knowing your risk is, once you have that risk, knowing what you need to do to prevent that risk from manifesting. So having the score is an objective marker on a piece of paper to tell you, hey, you need to aggressively change the way you're living and aggressively address your cardiovascular lifestyle and habits so that this event doesn't occur. And so you can do that naturally, and there's also pharmacologic recommendations too, depending on certain scores. But some tests have shown that even the pharmacology isn't helpful at a certain point, and especially not if you're not making the lifestyle changes. So to wrap it up, if you are worried about early cardiovascular death or an early cardiovascular event causing death, then one way to determine for sure what your risk is, and the most specific test out there to know, is the computed tomography calcium scoring, or a CT calcium score. You can get that done at local imaging centers around you. You'd have to call them up and see if they offer it, but if they offer it, it is a cash-based service in many places for a very affordable fee for the information that it gives you and the peace of mind that it gives you.